Madam President, I think one of the things that we all get to do as freshman senators is sit in that chair and preside over the Senate at various times, and so consequently, we often get, perhaps more than our other colleagues, a chance to hear the folks on the other side's talking points. I think Monday afternoons I get to hear, sometimes for uninterrupted hours, the talking points. And what I hear time and again from our colleagues on the other side is complaints here and there about the various proposals that this side, and hopefully some on the other side will join us on, have put forward. But what I don't hear from the other side is ever what happens if we take their approach, which is doing nothing. What I don't hear from the other side is a simple recognition, not of the moral challenges of covering close to 30 million additional Americans, but the very real fiscal challenges of not acting. A fact that we all brought forward last week when we pointed out, if we fail to act, we will see Medicare go bankrupt by 2017. If we fail to act, our deficit numbers will continue to explode. If we fail to act, an average Virginia family, and imagine an average Colorado family as well, will be spending close to 40% of their disposable income within the next decade on paying for health care. And as Senator Merkley and Senator Begich have mentioned, if we fail to act, American business can't compete when we've got to pay $3,000 to $4,000 more per employee than any of our competitors across the world in terms of increased health care costs. Now again, some may say that the simple reason of these increasing health care costs are because we have an aging population. Well, we do have an aging population. But an aging population is not the effect of the rising health care costs. Our rising health care costs are increasingly driven by an inefficient delivery system, by a system that can't reward value, by a system that doesn't compensate based upon any rational basis. And that's where so many of the reforms that are working through the Senate Finance Committee and the HELP bill, and which I think we as a group of freshmen will be putting forward in later weeks and perhaps even on the floor, on how we can bring these reforms to the overall delivery system. Again, some of my colleagues have already mentioned this. Senator Begich mentioned wellness. Senator Shaheen mentioned as well the enormous differentials between different states in terms of just Medicare reimbursements. We must and can do a better job. For example, if we see right here, if we can put healthcare reform in place and drive system reform, we can save for our overall system $3 trillion over the next 10 years. We fail to act, we leave those $3 trillion caught in a system that doesn't provide not only good quality health care, but again, for the 70% of our costs that are dealt with chronic diseases, not better coverage as well. Finally on this last page, just in terms of what we're talking about in the expanded savings, if we fail, if we simply expand this current system, and this is based upon the Lewin Report studies, the Commonwealth Fund that has been cited many times by our friends on the other side, if we fail, if we put in place simply coverage without reform, yes, we can continue to explode the deficit. But if we put in the kind of reforms that we're talking about, which are wellness, which is increased transparency, I strongly believe in a free market system, but we have no transparency in our healthcare system in terms of what costs are and what people actually pay. If we take advantage of some of the best examples from private sector, where healthcare reform is taking place right now, we can bring about not only reform, but bring about reform with lower cost, higher value, and truly make sure that Americans all across this country get the coverage they need and that we don't break our deficit.